We'll begin the briefing today with remarks from Governor Tony Evers.
Good afternoon, and thank you so much for being here today. Before I get into today's update, I just have to say thank you to the people of Wisconsin for taking our Safer at Home order seriously. We know this is tough, but it's a necessary issue in order to stop the spread of the disease and to flatten the curve. So thank you very much. It's hard work, and I know it is, but it will pay off. As Secretary Palm and Dr. Westergaard mentioned last week, we know that cases will continue to rise over the next few weeks, especially with our expanded testing capacity. You might wonder if Safer at Home is working, but the science and the data tell us that staying at home is effective. So stay the course, Wisconsin. The more we all stay safer at home, the sooner we can get through the worst of this. We're saving lives by being safer at home. And now I'll get into today's update on Wisconsin's 24/7 Wisconsin state government response to COVID-19. State agencies, along with the Wisconsin National Guard and Wisconsin Emergency Management, are working around the clock to keep our communities safe. One of our most significant joint efforts has been the acquisition of personal protective equipment, or as we all know now, PPE, and additional testing supplies. I'll remind folks, Our administration continues to work aggressively to acquire PPP through multiple channels, which includes FEMA and the Strategic National Stockpile, or SNS, procurement, donation, and through a buyback program. Wisconsin is competing not just with other states and competing with the federal government, but with the entire world to get these supplies. This is obviously a global crisis. I'll remind folks about our donation and buyback program that we launched last week. Wisconsinites can go to COVID-19 supplies, one word, .wi.gov/donations to either donate or sell large quantities of PPP to the state, such as masks, gloves, and gowns. The good news is that, due to the generosity of hundreds of Wisconsin businesses, nonprofits, and even individuals, we've been able to start distributing donated PPP to our local communities. But the bad news is we need much more. We need PPP and other supplies in order to increase our capacity to test tens of thousands of Wisconsinites, isolate and treat those who are infected, and do our best to contain the spread of the disease. Now, to be clear, we haven't been waiting to take action. We are aggressively pursuing any and every lead to buy these supplies. Many of our state's agencies are pitching in to assist the state emergency team with purchasing these supplies on our own. Our administration has also been working closely with other states to combine our purchasing powers to make larger bulk purchases, which are usually given priority. We are headed into the worst of this, folks, and the need is only going to get greater. That's why our leadership team at the State Operations Center has also been preparing to support our hospitals and our local and tribal health partners to assist them in setting up voluntary isolation centers. We're also working with the Army Corps of Engineers to ensure that field hospitals and facilities will be ready when the surge of acute cases begins to hit our healthcare systems in the coming weeks. Now, I trust science, our public health experts, our emergency management professionals, and our military leaders when they say these plans are necessary. I'm sure many of us would like to just wake up from this nightmare tomorrow morning and say it never happened. But the responsible thing to do is plan for the worst and hope for the best. So that's exactly what we're doing here in Wisconsin. We can and should learn lessons from other communities. Listen to the science, be prepared, act swiftly, and save lives. Now, in addition to the good work we are doing right now at the state level, and in partnership with our local officials and the private sector, it's imperative that we move forward with further health and recovery efforts. The new federal law, called the Families First Coronavirus Response Act, is a great first step for our workers, businesses, families, and communities. This bipartisan effort to respond to the public health emergency that our nation faces is essential to ensure that we have the resources and flexibility to respond to our state and local needs. From the immediate health care and first responder needs to impacts to workers and businesses and our child care and educational systems, swift action is needed to respond to this public health emergency. Every day makes it more clear that a collaborative state and federal response must allow maximum flexibility for us to respond to emerging and urgent needs. Our state agencies have been hard at work, and we're learning more about the funds coming in from the federal government, including when we will receive these dollars and how they can be spent. Again, we hope for maximum flexibility in terms of meeting the needs of Wisconsinites across the state. However, even with these federal dollars, we will still need solutions at the state and local levels. Our state agencies have been hard at work to identify what's needed to ensure public health and safety in the near term and to aid our economic recovery in the weeks and months to come. Some of our most immediate needs include greater flexibilities within the Department of Health Services so that they can act rapidly and ensure folks are getting the care they need without any unnecessary barriers, such as pre-authorization requirements. Lives are on the line here, and we can't afford to be hamstrung by bureaucratic hurdles. We also know that other state agencies will need additional resources. One example of that is the Department of Workforce Development. Last week, more than 115,000 new preliminary unemployment insurance applications were filed with the DWD. That's 115,000 1 week. The UI call center also received more than 1.5 million calls in that same time period, which is an increase of 6,208% over their average weekly call volume. Just to underscore how significant the need is for these benefits, last Thursday, DWD received 400,000 calls between 6 and 10 a.m. At one time, they were averaging 160 calls per second. The system was not built to handle this call volume. However, we're working every day to increase that capacity. DWD has increased their phone capacity to allow 690 simultaneous calls. They've also expanded staff capacity at the DWD call center from 57 staff to 92 staff. But they're going to need even more help. DWD needs at least 80 additional staff to help triage calls for unemployment. And we need the legislature to take action to get rid of the 1 week waiting period before folks can start receiving benefits. Now that's just one agency. We know that we will need more staff and more resources to support small businesses, to help our farmers, to expand healthcare capacity, and to keep our communities safe and strong. Now I know that everyone shares my concerns about public health and safety and about the economic recovery. We look forward to working with stakeholders and our partners in the legislature to get things done as soon as possible. Thank you so much, and I'll now turn this over to DHS Secretary Andrea Palm.
Thanks, Governor, and thanks again to everyone for joining us today. So I'll start where I always do. Here are our numbers for today. 15,856 negative tests, 1,221 positive results, and we now have 14 deaths in the state of Wisconsin. The positive tests that's 109 more than we were at yesterday, and obviously that is an increase of one death over yesterday. That was of a male in his 40s. You can find these numbers as well as the county breakouts of this data on the DHS Outbreaks and Investigations webpage. Now I want to take you back to just about a month ago when Wisconsin had fewer than a handful of confirmed cases, and our state lab had finally received the test kits they needed from CDC to begin running COVID-19 tests here in the state of Wisconsin. They were quickly joined by the Milwaukee Health Department and have ramped up over the past month to a combined throughput of about 500 tests per day. In addition, a network of labs across the state scaled up, averaging 1,500 tests per day. And while there is no backlog of tests, we have prioritized healthcare and long-term care workers, hospitalized patients, and those at risk of the most severe disease from COVID-19, while continuing to work to expand our testing capacity so we are in the best position to respond to this evolving pandemic. To that end, we stood up a strike team as part of our statewide response that includes additional labs and industry leaders in both the private and public sectors. Just like during H1N1, we knew that testing for this virus would require assets beyond the state lab. And for this response, that has taken the form of a strong partnership between government and some of the best and brightest minds in business and technology. Lucky for us that we didn't have to look very far to find them. Our lab capacity strike team has welcomed the expertise and insight of leaders from Epic Systems, the Wisconsin State Lab of Hygiene, and numerous other state agencies to share resources, equipment, and knowledge to remove barriers and enable us to add to this next layer of capacity, which, as we announced earlier today, will initially double our lab testing capacity. These additional partners, all Wisconsin-based, include Exact Sciences, Promega, UW Health, and Marshfield Clinic. These companies are pulling together and stepping up to provide operational and resource support to one another to bolster our state's testing capacity. But I want to be clear. Testing will still require a doctor's order, and these partners are not testing sites themselves. They will be receiving and processing the tests that are completed by healthcare providers. So while this is a critical step forward, it is important to remember something we have talked about a number of times before, that the supply chain for testing materials is extremely fragile due to this worldwide pandemic, much like the way the governor talked about the PPE challenges we're facing. So our new lab partners and our public labs will continue to be limited by access to the materials from their national suppliers and the federal government to complete these tests. And to that end, you remain a critical partner. We all need to continue to do our part to remain safer at home. Please continue your good hygiene practices. Continue to wash your hands often with soap and water. Cover your coughs and your sneezes. And when you leave home for your once-a-week grocery and pharmacy run, please exercise strict physical distancing. Stay at least 6 feet from each other. The more we all pull together while keeping our 6 feet physical distance, the better it is for all of us, and especially those on the front lines of our healthcare system, tending to our most severely ill friends and neighbors.
Más cerca de ti, más cerca de